oxytocin makes you feel so good, but it's also that bonding what brings her closer. And so oxytocin and cortisol or adrenaline, other adrenal stress hormones, are balanced by each other. So you're flooded with her oxytocin, your oxytocin. It's all an energy thing. And so hi, welcome this week to The Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you today.
This is Levan.
The parenting show. Lauren's had her baby, and we're so glad to introduce her to the world. What were we saying? This is her first debut at 1 week old?
1 week old and already making her on-cam debut.
Super exciting. We're going to be talking about parenting today, and we're going to talk about the hormones of parenting, but we're going to talk about 3 different ways to hold your children accountable. And it's great when you have a mom that understands this and starts when they're this early, but it's never too late. Even if you have a kid in an apartment in their 20s, it's never too late to start the accountability and parenting. So that's what we're going to be talking about today. We'll take a little break and we'll be right back.
I have osteoarthritis, and the arthritis medication that you get regularly will cause your kidney function to go down, and my kidney function had started going down, and so I knew I needed to do something different. I've been seeing Dr. Tammy for about 3 months, and she's been doing stem cells in my knees, and it's like a miracle. She absolutely hits it every time in the correct spot, and I am pain-free now, and I haven't been pain-free for about 10 years. I can go upstairs without pain. It's wonderful. And I send everybody I know to her because she's done such a wonderful job for me, and I just appreciate it so much.
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
A great show for you today. We have Levan on the set.
Hi.
Kind of crazy. We actually did the first part parenting show the week before she came. And we just kept talking, and there was so much to talk about that we said we're going to do a part 2. And then
I was hoping she'd be on this side of me.
Oh yeah. Oh my gosh. And then I'd go up to your office, and you were so huge. I mean, there wasn't a bit of room for Levan anymore. I would sit on the end of the desk, and I couldn't even look at your belly because it just hurt me. But yeah, that was crazy. So we took a break from the show last week to have your baby.
Yeah.
Here she is.
And now we have this little bundle of joy to help us introduce parenting part 2.
Super precious, yeah. So we're going to talk, of course, a little bit about hormones, and we did a show about progesterone, which progesterone is one of the main female hormones. Males and females have the same hormones, but progesterone, the Latin term is progestation. So it's the hormone that makes you very tired when you're pregnant. And I remember you were dying, but it's also the hormone that maintains the pregnancy as well. And then a little bit, some people can have that dip in progesterone after the baby comes. And one of the ways to keep the progesterone levels balanced is actually breastfeeding.
Oh,
so yeah.
Nice. Yeah, I was going to ask you what hormones really shift after you give birth, because, I mean, I feel like I can fly. I'm like, oh, I forgot what it feels like to feel like me. And I'm sure that people who have their hormones off balance walk around all the time, feeling that offness. And people, not even people who've had babies, but it's just it totally changes your way of living, and it's like getting back to this balance of my hormones and everything is a game changer. I feel like I can just, like I said, I feel like I could fly, and I don't remember having this like it being this easy. So
well, I think it's kind of like when we get menopausal women or we get men with low T, and it's like, I call it boiling a frog slow. You put the frog in the tepid water and you turn up the heat slowly, and it doesn't even realize until it's like dead, boiled. And so a lot of times when the hormones are imbalanced, it's like there's this gradual of, I don't feel that good, but you don't really notice. And so I think that's kind of like that with pregnancy. Maybe, it's like it builds up, and it's like by the time you're kind of towards the end and you're, miserable and not sleeping well because everything's going on, that, just that release and everything's balanced back out. You feel like you can fly now.
Yep, here I am. Yeah, like a huge weight has been lifted off my shoulders, and I can tell. It's so interesting how, because whenever you're pregnant, your skin's just be like really nice, and your hair and your nails, which my hair's not really that long, so but my nails and stuff and my skin were really good. But I noticed, like, after I had her, that it was like I already started being a hormonal teenager again, like breaking out, not really breaking out, but like the first any sight of that at all since I was pregnant. So I was like, what hormone, what increase or decrease or whatever in hormones caused that? I don't know what it is, but
well, an interesting thing about that is there's a hormone called oxytocin, and it is called the bonding hormone, or the
love hormone.
The love hormone, the cuddle, snuggle, makes you feel good. And it was interesting because we were talking about this the other day. When Donnie, my son, was born, I had the C-section and had the spinal, and I couldn't get out of the bed, and he's in the neonatal ICU, and so it was like that drive, that oxytocin rush was so strong that literally if I could have crawled into that NICU, I would have. I mean, it was such a maternal instinct. And
where's my baby?
Where's my baby? And oxytocin makes you feel so good, but it's also that bonding what brings her closer. And so oxytocin and cortisol, or adrenaline, other adrenal stress hormones, are balanced by each other. So you're flooded with her oxytocin, your oxytocin. It's all an energy thing. And so some moms don't have much oxytocin, or they're stressed out moms, or moms on drugs or medications, or all sorts of different things. So that's why you get some moms who don't bond very well. And one of the interesting things about being induced too is that's Pitocin, which is like oxytocin. And sometimes that saturates all the oxytocin receptors, so that there's all sorts of challenges later on down the line. But I mean, I don't want to scare you. Plenty of babies are induced. But it can be an issue in people that are, prone to imbalances in hormones.
Okay. And I guess if your oxytocin is off or imbalanced, it's going to cause the imbalance in other.
Right. And so if your cortisol is high, now you have that whole, we talked about that, the imbalance between the other male and female hormones. And so that's probably causing you a little bit of instability when you had a little bit of issue with your skin. But it's great how it all balances out. And just holding her, that oxytocin effect on you is actually balancing your hormones. So.
You make me feel amazing.
Yeah.
And so balanced.
She's like medicine.
She's like,
It's like bioidentical hormones.
Right.
Yeah.
It's so funny.
So all good stuff. Yeah. And so, it's just understanding that. And a lot of times when we have women who have problems with their dips in progesterone or postpartum depression, that kind of thing, we can help them. But, it's interesting talking about parenting. I have a friend who was talking about her son who's 14, I think, a boy, right? So we don't normally think about female hormones in boys, although all of us have the same hormones. It's just different concentrations. But he's having trouble sleeping. And so the doctor was going to do the Elvis regimen. You ever heard about Elvis? They gave him drugs to put him to sleep and then drugs to help him wake up. So it's like they give you drugs to help you sleep, but then you got to have something to wake them up.
Right.
So I'm like, oh, no, wait, before we do that, let's check his hormone levels. Because it could just be an issue with that. And
like adrenals or something.
Yeah. Or low progesterone.
Yeah. Yeah. Because, I mean, doing the sleep drug and the wake up drug, that could really affect your adrenals to where it would make it even harder for him to be able to naturally, go to sleep and wake up, you know. And he's a teenage boy?
Yeah.
Oh, yeah.
So already starting down a really interesting path.
Yeah.
Yeah. So we kind of promised a couple of different ways to keep, accountability. And so one of the things that talking about stress, kind of the lead into that, is that when you are stressed or your child is stressed, it creates a hormone called adrenaline, which is an adrenal hormone that makes you feel shaky, jittery, bad, and the oxytocin balances that out. So a couple different ways is what we call proactive parenting, and that is from a place of love and bonding, and the relationship is everything. But proactive parenting isn't easy because you have to set the boundaries, the rules, and it's communication.
So that's the thing, is that's proactive parenting starts with you, and you have to figure out what it is what structure and what rules and what boundaries you want for your household or for whatever it is with your child, and then you also have to hold them accountable to that. And then if they aren't doing what you said, you also have to give them the appropriate discipline, whatever you laid out there. That it takes work as a parent, so it's not like you can just let your kid kind of go off freely and like,
free range kids.
Yeah, they'll figure it out. Because what happens is yes, that's work to do, but that is so much less work than it will be if you have to end up being a reactive parent, because reacting and impulsively responding to things that your child does is not productive, and it doesn't help shift, or it just makes you more of a controlling person as instead of being a leader in the household. So while it seems like a lot more work to hold them accountable, and if you say this then you stick to that, it's a lot less work than having to go back and fix issues if you don't set that structure and those rules initially.
Yeah. So thinking about 3 ways, and we can kind of just bounce this off each other. One way is basic needs are met. If your kid's hungry or tired, or if you're not taking care of basic needs in the home, which I think most of our watchers who are out there, are taking care of their kids' basic needs. But sometimes it's just, is your kid staying up too late, and are you proactively monitoring, what their schedule is? And I know with my son just starting back to school, we're talking about back to school. He's on that night owl schedule, and so he's really tired. And so the other morning we were driving to school, and I'm like, hey, he's like, don't talk to me. And so we start down that path of already getting off on the wrong foot and creating those negative feedback loops and things like that. And then the other thing, and we can break these down when we come back, but the other thing is accountability, and not parenting out of shame or guilt, or like when you discipline, I like the word discipline rather than punishment, that you do it to teach rather than because you're stressed out or mad.
Out of anger,
or out of anger. And then, I think the last one is just remembering that the relationship is always love, and how can you come at it from an angle of love that maintains the relationship, and you don't want to ignore their behavior, but just to really come at that from a place of love.
I like it.
So we got those 3 things. We're going to dissect those down just a little bit, and we'll be right back after the break. Hi, I'm Dr. Tammy, the Hormone Queen. In my almost 20 years of experience in working with tens of thousands of patients, I found that hormones have everything to do with weight loss. There are fat burning and fat storing hormones, so you have to maximize the fat burning and minimize the fat storing hormones. I've created Dr. Tammy's 21-day metabolic solution, which will help you heal your metabolism and lose weight. Very exciting. So what do we have? We have my daily metabolic support, which is formulated with all the ingredients to help your fat burning hormones work better and to minimize your fat storing hormones. I also have a great whey protein if you need a little bit of a meal replacement or just to help with some of the appetite. Helps with that glucose metabolism, because let's face it, sugar storage, insulin, those issues are huge with trying to lose weight. And when you crave sugar, it's just no fun. So you're never hungry when you're doing this. Our Detox Complete helps heal the gut so that your body can absorb all these nutrients, because if you don't heal the gut first, then you're wasting your money on all this distillate stuff. So I wanted to make sure you have all those great amino acids and anti-inflammatories. And one of the things that we found is most people are not overweight, they're inflamed. And so you have to treat the inflammation for you to lose the weight and for it to be sustainable. I also have my secret weapon, which I absolutely love, which is methylated vitamins. This is L-methylfolate, and this helps clear toxins because most people are not only inflamed, but they're toxic. So this helps clear all of that and helps your hormones work better. And then we have a great probiotic. There have been studies that have shown that people who are overweight have different bacteria in their guts than people who are thin. So if you want to be thin, you need the thin bacteria. So this probiotic helps heal the gut, and all of these things together help your metabolism work better and help you lose weight faster. Hi, welcome back. We have a great show. We're talking about parenting. We've introduced Lauren's baby Levan for her debut to TV on the Naked Doctor show.
She's got a lot to say.
We're talking about the 3 ways that you can improve your parenting, which is basically just the magic of proactive parenting. And the best way that I think of that is it was a big shift for me from a love-based consequences, yet setting the consequences proactively before, and not just, beating your kid or corporal punishment, which is a place that I come from
The way you were raised?
Raising, yeah. And it was
and not even just that you were getting the punishment for your actions, but you were guilted for your actions because your sibling was getting
which is very, very common. It's just a strange dynamic that just the recognition, bringing that to the conscious level. And so one thing right along with that I realized one day was that kids are a reflection of us, and the stress levels that we are feeling are what they're mirroring. It's called mirror neurons, and it's like they see it and they reflect that back. And especially, my son is got some sensory special issues and things like that. So when I'm stressed, he feels it, and it doesn't take much. And I realized one day that he'd been lying, and lying is just a behavior that is a symptom of stress. And so I noticed that when things are not going well in my life for whatever reason, he feels that, and it's like some weird behavior will manifest. It doesn't even need to lie, but
it's like something in him makes him feel like he needs to tiptoe around like what you got going on, and it's probably he's disconnected and probably thinking that if you're stressed out, you're gonna get mad at things that you you're gonna get mad at things that you're not mad about, or you wouldn't get mad about, and so then he's reacting to those things, and which is out of his character,
right? So when I realized it was my stress that he was mirroring and feeling, and I calmed myself, everything changed with him, and he didn't do it anymore. So, and I think just communication. He's 15, so it's much easier to talk to him, but we can baby talk. But just having those conversations, and we get busy, and I'll admit it's so much easier to let him go sit on his computer and eat food in his room, and pop his head out like a little turtle every once in a while. But that is not proactive parenting.
And I feel like you are so not alone on that either. It's like, take your iPad, get away from me.
Yeah.
Because it's like, oh man, all I want to do is just not feel stressed out. And that's a reactive parenting move, doing that, giving your kid something to, I don't want to, whatever. I mean, granted, there's age ranges that like, okay, I just need to keep my kid stimulated on some level. But like, instead of, sometimes it's, we do that because we don't want to have to deal with the accountability part of the parenting, and it's like we just kind of send them off and pretend that they're perfect.
Yeah.
They're not doing anything wrong, and they didn't do anything wrong. They're just keeping themselves busy on their, their games or their iPad.
Well, there's kind of limiting beliefs or beliefs that we have based on like the way we were parented too. And so I don't even know what we did before electronics, but I think it was even more so that kids really didn't speak up. I think from my generation, it was kids are supposed to be seen and not heard. And it was just, we
especially as a female, probably
especially
more
as a
so.
female, which kind of suppresses your voice, which whole nother show there. But just the stress of parents being stressed out and projecting that onto their children kind of creates that whole carrying on that generational reactive parenting, you know, and then sometimes I wouldn't even know I was doing anything wrong, and then I'm getting beat, you know.
Right, because you weren't having any proactive parenting.
Proactive parenting.
That was very similar to the way that I was raised, but I had a lot of freedom, but really I didn't have a lot of freedom, you know, like it was like I could do whatever I wanted, but basically I had no structure. And so it was like we were just, you know, we were the kids just live and do whatever we want until it was like, you know, Dr. Jekyll, Mr. Hyde came in there screaming, raging, you know, and I was in trouble for putting the dishes the wrong way in the dishwasher or something crazy that I didn't know.
Because the parent probably got stressed out. And then,
about something totally not, you know, related to that. But, you know, coming in with that stressful energy and then we take the heat of that. And that wasn't productive as a child of that, as a recipient of that. That's not, you know, that makes the house feel, you know, very unsafe and unstable, and it's really hard to find your grounding in an environment like that, you know. And I mean, my parents are awesome, so not that on any level
they're just doing the best they could, and living their life, and
I wouldn't change a thing at all. It just gives me understanding and perspective of you know what I want for my kids, and
I've done the same thing. I've parented that way too. You know, I've been stressed out, and then, you know, yelled at Donnie for something completely unrelated that was completely not even something to get stressed out and yell about. But it was just a symptom of my stress too.
Yeah.
So it's just recognizing that.
Yep. And which is your stress is, you know, your hormones.
Oh yeah, a little plug for that. If you're a mom that's being reactive like that, and
or a dad.
Hormones big impact. So getting those checked and balanced are super important.
Because if you're not stable, then how can you expect to give stability to your kids? You know, that's if you find yourself like really being reactive to your kids and not ever feeling like you can catch up with your parenting and, you know, gain some kind of order in the house.
Maybe just you're tired because your thyroid's crashed on you or something, and you just don't have the energy to both keep up, interact. And
that's how I felt being pregnant. You know, it was like I felt like I didn't have the energy to parent my 10-year-old, you know, but it was like the challenge was so, I mean, there was such a very clear purpose for having that challenge, and recognizing how much of it was coming from me. And, you know, and it's just, you know, my daughter's the perfect person to always wrap me back into alignment, you know, on whatever level, you know, like recognizing my own stuff and adjusting to be able to regain peace, you know, and not have that stress level in the household and everything. Because
alignment's everything. That's where the love comes in. Is just remember, if this person weren't there tomorrow, would I miss them? You know, like, not from a, you know, don't want to attract that, but it's like, just remember how much you love them and that you would never hurt them.
Oh, totally.
You wouldn't let someone else treat them that way.
And then you get to the point where you feel guilty for how you acted, and you're like, I'm so sorry.
Oh, and then you loop into that negative loop from parental shame, and then you stop holding them accountable. Yeah. I just did the same thing with Donnie this week. You know, it was like, I kind of realized that, you know, I kind of lapsed a little bit and other things were going on in my life. And then the next thing I know is I'm not holding him accountable to making his bed and doing all the things that we agreed he'd do, especially this school year.
Yeah. And if you're the type of parent, well, if you're a parent who shares any time with another parent, you know, sometimes it takes your kid adjusting back into your system, and then you adjusting to having them back around, you know, because when your son's gone for the summer, you kind of forget about the accountability part with, you know, because it's work, and it's like, oh, this whole summer I haven't really had to worry about something like that, you know, and then so you're having to readjust to help your situation. So
I think everybody has to kind of readjust this time of year. And if whether you're a grandparent or you're just, you know, you're in a workplace and you've got parents who their kids are good, you know, that's it's like a ripple effect. It's all energy, so it affects everybody.
Yeah, definitely.
All right, I think we're probably hitting close on our time, so we're going to take a little break and we'll be right back.
A few months ago, I went to Dr. Tammy with some foot pain. I had inflammation on the tendons. She recommended PRP, and we tried it. A week later, I had no pain. Till now, I've had no residual pain. I think it worked very well.
At Christmas time, I went in and I saw her, and we did a stem cell PRP and in my hip and my shoulder, and it was like a week later, it was, I felt so good. I wasn't able to sleep with my arm up or anything because it hurt so bad to put my hand behind my arm, and the joint pain is all gone in both areas.
After using Dr. Tammy's services, I've been extremely pleased. I've had nothing but good things to say about her, and I will continue using her in the future.
I recommend, if you're just feeling old, tired, and the daily grind is getting you down, just go see her. She's life-changing.
Hi, welcome back. We've had a great show this week. It always seems like there's not enough time to talk about all the things.
You're trying to take a break. I was like, I don't want to.
Really? It's not time. And then we go back and edit all this stuff. You'll be like, man, why did we talk so
And I'm like, there's nothing I can take out. You know, I'm like, it's gold.
It's gold.
So yes.
Yeah. So parenting, and it affects us all, even if you don't have kids. You've been a kid at one time. You have friends and family with a kid. And, you know, it's funny because I don't think of myself much as the maternal type or a bonder, but I was holding Levan when she was first, born in the hospital. I just started tearing up, and I was like, just realized how precious it is to be a mom. And I also realized that it's gone in a blink. You have to appreciate every single day, whether it's in the parenting arena or not, because it's like 15 years is gone just like that. Yeah.
You're like, whoa, you're taller than me now.
Yeah, he is.
And you're tall. Yep, she does that to me too. So she makes me cry too. I just leave her like, my oxytocin is just so much.
Just love you so much. Well, thank you for being here today, Levan. We're so glad to introduce you to the world.
Holla.
Peace out. Check us out on the Naked Doctor Show Facebook page and healingartcenters.com if you want to schedule a time to come visit with us about how to maximize your hormones and be the best parent or child that you can be.
You get those hormones straightened out.
Yeah.
So,
Little Instagram action. We got Healing Art Center on Facebook as well, and my Dr. Tammy page on Facebook. And we also have a new product line we launched. So Lauren said she's on the CarbMelt program, the weight loss supplement we have. She's lost 17 pounds in 7 days. No, that's just breastfeeding and carrying a baby around. But
just getting rid of some water.
we should maximize that. So check out CarbMelt.com, and especially if you got some baby weight to lose, that can absolutely help. We
Definitely.
got lots of fun things coming with Lauren. She's going to do some weight loss stuff and get her baby body back. Yeah, I love it. It's already really awesome. I took a picture of her in the hospital, and I was like, looks like she's still pregnant. I'm not going to say anything.
My friend's daughter came in there. She's like, are you going to have another one?
Oh, gosh.
I was like, why? Because my belly. She's like, I was like, no.
Hey, and if you look like you're pregnant, it's like I learned you never ask a woman if she's pregnant, because sometimes it's like, so if you have cortisol belly and you have people asking if you're pregnant and you're not, then come see us too, because we can help you with that.
Definitely.
We love you very much. It's been a great week, and we'll see you back here next week on The Naked Doctor.
Thanks for watching. Bye-bye.